This is the femur. The best way to determine left from right is find these knuckles, hook it on your knee. If it hooks on your knee, you know this side's anterior, this side is posterior. Next, you have to find where the head attaches. This doesn't look right because the head can't attach that way. So if you put it inwards and this fits, then this is the side. So this is going to be your left femur, alright? We're going to start at the top. First we have the head of the femur right here, this ball. This is what actually goes into the acetabulum of the os coxae. You have a little divot right here, this hole. This is the fovea capitae. Then you have the neck of the femur. Going alongside of that, you have two very obvious markings that you will only find on the femur. Trocaners. This is the greater trochanter, and this is the lesser trochanter. Going in between it, you have an intertrochantular crest. Alright, this is on the posterior aspect, as you can tell, because these are hooking inwards. So this is your intertrochantular crest, and then on the front side, you have this very obvious line. If you feel it, it's going to be roughened. This is going to be your intertrochantular ridge, or line. Going down, see how it's nice and smooth? It bifurcates into the two knuckle-like projections. These knuckle-like projections are called condyles. So, flipping on the posterior aspect, since this is now going to be lateral, this is the lateral condyle, and this is the medial condyle. They kind of wrap around the front to form this patellar surface, this really smooth surface where the patella, the kneecap, goes right on top of that. And then on the back, you have this really roughened surface towards the top, right underneath these trochanters. This roughened surface is going to be the gluteal tuberosity. This is where the gluteal muscle is attached to the femur, allowing you to flex your leg muscle. This little white line runs down and then it splits off. This white line is called the linea aspera. It splits off into supracondylar ridges. So you have two. So this side is your medial side. So this is going to be your medial supracondylar line, and this is going to be your lateral supracondylar line. Right here, in between the two condyles, this is your intercondylar fossa. Fossa is a depression right there. And again, since these are condyles, there are two little raised condyles above it. So this is going to be your medial epicondyle, or sorry, this is your medial epicondyle, and this is your lateral epicondyle. Again, on the front side, you can still see them: medial epicondyle, lateral epicondyle. And that is it for your femur.